Hi everyone, welcome to my YouTube channel. My name is Mudube. My friends call me Dube or Gypsy. Just a bit of an introduction about myself. I am a medical doctor and I have been for the past 8 years. I'm currently practicing in the United Kingdom and I hold an MRCP in medicine. For, as a bit of a disclaimer, I'm not a gynecologist. I'm not a family physician, but this project is very dear to my heart, and I'm hoping to use this channel to address lots of questions that I keep getting regarding feminine health, or questions pertaining to issues women face on a day-to-day basis. Right. So today I'm going to be talking about breast cancer. Okay. Now, I come from a family of 8 kids, and we're all girls. And obviously, I have a mother and I have a grandmother who is still living, thank God. Um, and Today, I want to talk about breast cancer and educate us about things to look out for when we're worried about breast cancer, or things we need to be aware of that could possibly suggest early signs of breast cancer. Now, a bit of an introduction about breast cancer. Breast cancer is the most common type of cancer in women in the United Kingdom. About 1 in 8 women will be diagnosed with breast cancer in their life, and it tends to affect mostly women who are above 50, although obviously we still find breast cancer in young women, and occasionally, although rarely, breast cancer can occur in men. Okay. It's always best to detect breast cancer earlier on, because if it's detected whilst it's still small, or whilst it's still contained within a local region, you have a better prognosis, you have a better chance of surviving breast cancer, and you have a higher chance of having just localized treatment for it. Okay. Now I'm going to tell you about the possible symptoms of breast cancer, the things you need to look out for, um, or the things you need to, that need to trigger your mind to think about breast cancer if you did detect them in yourself. Now, the most common symptom is finding a breast lump. So, because obviously breast lumps sometimes aren't visible to the eyes, it is advisable to always be breast aware and always feel around your breasts, and to aid early detection of these breast lumps. Now, there are other symptoms of breast cancer, as some of you might well know. One of the other common side, one of the other common symptoms of breast cancer is nipple discharge. Now, there are some physiological nipple discharges. What I mean by that is there are some nipple discharges that are normal, especially in a lactating woman. Um, Obviously, we know that. But the things to worry about is if you have nipple discharge from only one breast, that should trigger your mind. Secondly, is if you notice that the discharge was bloody, or it had a different color to what you would normally expect, if it's normal for you to have a nipple discharge. Now, the other things you need to look out for are nipple inversion, and that will mean your nipple becoming going inwards rather than coming out. Okay, you have to look out for skin changes around your breast, such as dimpling, skin tugging, something we call podorange in medicine, which means that your nipple tends to, sorry, not your nipple, your breast skin, the skin around your breast, tends to develop what looks like the peel of an orange, with pores and kind of looking engorged. The other thing to look out for is breast swelling. I mean, one breast might be more swollen than the other. All these things you need to look out for in yourself whilst um, examining yourself to detect to examine when you're whilst examining your breasts as recommended monthly. Now let's talk about the causes of breast cancer. Right. I get a lot of these questions. A lot of people ask me what causes breast cancer, what have I done, what did I do to develop breast cancer, was there anything I could have done differently? Now, unfortunately, science fails us at this point because the causes of breast cancer are not understood. There are certainly different things that we think predispose you to having breast cancer. There are your chances of having breast cancer increases when you're, for example, when you're overweight or obese, and so we encourage women and postmenopausal women to make sure they maintain a healthy weight. Now, we also know that your risks of developing breast cancer increases as you age. And so that means that the older you get, the higher your chance of being diagnosed with breast cancer. Now, breast cancer, some types of breast cancer runs in the family. And so if you have a strong family history of breast cancer, you are at higher risk of being diagnosed with breast cancer yourself in your lifetime. Now, if you've had a previous diagnosis of breast cancer, say in one breast, you're also at risk of having a recurrence on that same breast or a recurrence on the other breast. Okay. Now, if you've also been diagnosed with what we call a benign breast lump, what that means is you've had a breast lump that was proven not to be cancerous, you're also at a higher risk of being diagnosed with breast cancer going forwards. Okay. Now, there's this correlation between breast cancer and alcohol intake. That's because it's postulated that alcohol increases your level of estrogen hormone. That's one of the female hormones in the body. And if it's postulated that if you have excess or if you have a high level of estrogen, you're at an increased risk of developing breast cancer. But these are all postulations. You could not fit in any of these categories, but still develop breast cancer in your life. What we know is that we're not completely sure what the causes of breast cancer are. Now let's talk about diagnosing breast cancer. I think one of the most important aspects to this will be your monthly self-breast examination. So it's recommended and it's encouraged that every woman should examine their breasts at least once a month. We do find that during our menstrual period, or the days around our menstrual period, we find that our breasts become engorged and lumpy and sometimes tender. So it's advised to avoid those times. So most people would recommend examining your breasts whilst you're ovulating. That's the midpoint of your menstrual cycle. And there are different ways of doing this, but the most important thing will be for you to be aware of what your normal is. So that would mean you have to examine your breast standing in front of a mirror. You need to know what your normal size is. You need to know, what the variations are. Your left breast is not identical to your right breast, and so you need to know what is normal for you. Now, it's recommended that you examine your breast with your hands to your waist and also raise it with your arms raised up. Now, the important thing as well is the things to be aware of when examining your breast will be to, first of all, to inspect. Look at your breasts. Are they swollen? Can you notice any skin changes that is not normal for you? Is your nipple out or in? Are your nipples discharging are you having any abnormal discharges? Have you noticed any tug in your skin? Is there anything different at all that you're noticing in your breasts? Now, that's the first aspect. The second aspect would then be to thoroughly examine your breast, to thoroughly palpate your breast. Now, I would recommend kind of dividing your breast into four, if that makes any sense. Now you don't have to do it with a knife, but just in your mind, if you divide each breast into four different quadrants, and using your palm, gently rub around it, rub each quadrant, rubbing thoroughly and going round. Okay, it's also recommended that after examining your breast yourself, you also examine your armpits, because sometimes you can have some lumps in your armpits. Now you repeat the same thing on your left and on your right hand side, and it's encouraged that you do this every month so that you'll be able to detect any early changes. Okay, now I'm going to post a link for a visual illustration of breast examination just below this this video. Now let's say you do detect a lump, or you do detect a worrying sign or a worrying symptom. What do you do next? Okay, so the most important thing to do next would be to have a chat with your doctor, to go visit your general practitioner, go visit your doctor, okay, and get them to examine you thoroughly. Now, your doctor might examine you and might not feel a thing, or your doctor might examine you and might find something. We don't know. Okay, the important thing is on your own part that you go speak to a doctor and you go get it checked out. Now, if your doctor is worried enough, or if your doctor thinks, yeah, it's worth you're maybe at a higher risk of having breast cancer, or that you're worried, your doctor might recommend some further investigation for you. Now, this might be something we call an ultrasound, which is a jelly scan of your breasts. It's usually quite good in detecting breast lumps. So that could be one thing that could be recommended. The second thing might be a mammogram, which is like an x-ray of your breasts. The decision for either one of them will be based on your age, or your size. Now let's say, and we don't hope it does happen, but let's say the ultrasound or the mammogram detects something. What next? Now it might be then that you will be sent across, so you will be referred across to a surgeon to get something we call a tissue biopsy. Okay, that would mean maybe making a small incision in your breast and taking the lump and sending it across to the lab to see if this is cancerous or not. Now, at this point, it's worth stating that detecting a breast lump is not the end of the world, because most breast lumps are benign. And what that means is most breast lumps are not cancerous. Okay, and then even if you were diagnosed with a breast cancer, let's say the breast tissue that was sent off has come back as cancer. I mean, science has gone, has made, there are so many new inventions, there are so many new medications, there's so many new treatments out there that a lot of people are surviving breast cancer, especially when detected early. Okay, so this video is not intended to make you panic. This video is intended to educate you and to let you know that education is key, early detection is key, having a chat with your doctor as early as you can is key, early diagnosis and early treatment are key. Okay, so if you are diagnosed with breast cancer, what would happen is you will be either referred to a surgeon or an oncologist, or both. Okay, so the role of the surgeon will be to perform a surgery to take away the lump and any affected area or any affected lymph node. Okay, the role of the oncologist will be to administer radiotherapy or chemotherapy, or both. Okay, now the decision for either one of these or a combination of these will be made by your surgeon and your oncologist most times. Okay, And this will depend on the extent of your disease. It will depend on a lot of things, including how you are, your age, your fitness level, everything really. Okay, now I think I'm going way beyond the scope of this video. I hope I have been able to impart some knowledge to answer a few questions. Now, if you do have any further questions, you can always drop a question in the comment section, and I will answer any questions I'm able to. Now, just a bit of disclaimer again. I know I am a doctor, but this video isn't intended to recommend any treatments or to recommend any medications, okay? This video is meant to educate and to make you more self-aware, okay? Now, I look forward to having a chat with you next time. Next time is going to be a different topic. It's going to be, we're going to be talking about something else, which I have gotten questions about as well, and I hope you do find this one interesting, and I hope you do come back and listen to the next one. All right, until next then, my name is Mudukwe. See you later. Bye.